Now, for the next point of focus, we need to bring out the fact that what you can have the next point of focus, which is the umbilical cord. Is it clear? The umbilical cord and the skin generally have the same microflora, and the flora is just generally going to be Staphylococcus. The Staphylococcus can be Staphylococcus aureus, or it can be Staphylococcus epidermidis. Is it clear? Epidermidis. So it can be Staphylococcus aureus or Staphylococcus epidermis. Is it clear? So those are the two major microorganisms associated with the skin. We have other microorganisms associated with the skin. We have also the group A Streptococcus, like the Streptococcus pyogenes, is still associated with the skin. And these two microorganisms at the level of the skin can cause what is called impetigo. Is it clear? You can have impetigo. Impetigo, you have pustules on the skin. When you have pustules at the level of the skin, it can cause impetigo. It can be as a sort of impetigo, or at the level of the umbilical cord, you have pus at the level of the umbilical cord. It is still it's an omphalocytis. It's omphalitis. So you can have impetigo at the level of the skin, or we can have furuncles. Furuncles is when you instead have two papules, but they are not having pus in it. So there are no pustules. They are only papules, generalized papules. Is it clear? They can tell you that they are pustules when you have furuncles. Is it clear? You have furuncles. Now, other pathologies which can affect the skin of the neonates, we have viral microorganisms. Is it clear? Viral microorganisms, you can have varicella. Viral microorganisms are even the most common etiologies of the infection of the skin of the child. In the case of varicella, we are going to have what? For varicella, you are going to have generally papules, and you can have vesicles. You have papules and vesicles, and the papules and vesicles are combined in a form of a dew water shaped flower. Is it clear? A dew shaped flower. Is it clear? Meaning that what? You have the vesicle in the middle, and then outside you have a maculopapular rash. Is it clear? Generally, that's the presentation of varicella. Is it like a dew water drop? Is it clear? On a flower. A dew water drop on a flower. That's the typical presentation of varicella. So you have a vesicle at the middle of a maculopapular rash, meaning that what? It's a vesicle at the middle, and then laterally you have a papule, and then lower you have a macule. That's a dew water drop presentation, typical of varicella. Now the other one, we have also measles. Is it clear? And measles is going to present with what? It's going to present with particularly macular rashes. Is it clear? It presents macular rashes, and we also have signs, symptoms of coryza. Is it clear? Because measles has different point in time. We have different phases. The first phase is the exanthem phase. The first phase is the prodromal phase. Prodromal phase of measles. For the prodromal phase of measles, what is there is that what you are going to have just symptoms of coryza. That is, you have nasal discharge plus cough. If you have catarrh, cough, and you have also conjunctivitis, is it clear? Or tearing of the eye. Those are the prodromal signs of measles. They are the first symptoms. After the prodromal, you have the the enanthem phase. Is it clear? In the enanthem phase, you can now see whitish spot inside the mouth, and those whitish spots are called the coplic spot. Is it clear? You can see inside the oral mucosa, coplic spot. Now, after the enanthem phase, you have now the exanthem phase, which are treated with fever and rashes, and those rashes are peculiar macular rashes. Is it clear? So you have macular rashes that start from the neck. So you have the posterior hairline, the posterior head hairline. Is it clear? That's at the level of the neck, and then it progresses now out of the body in a centrifugal direction, meaning that it's progressing from inside to outside. Is it clear? So those are the pathways that you have to visualize. Also, varicella progress in a centrifugal direction, that is from the trunk, and then it goes to the limbs. Now, also other microorganisms that can be associated with skin, we have other parasites. Basically, the other parasite which is particularly associated here, we have scabies. Scabies is called in our context camnogo. Is it clear? Here you have the typical presentation. The skin of scabies, you instead have burrows. Is it clear? It means that what the skin is going to be depressed We have boils. The presentation is that you have boils, and it's usually presenting at the level of the palms of the child. It can be presenting at the level of the armpit of the child, or it can be presenting at the level of the groin of the child. Is it clear? Is it clear? So, or also, particularly the exposed area. So we have the arm, the hands, you have the armpit, you have the groins, and you have the leg. Is it clear? In adults, this scabies is much more going to present in the armpits and the groins. Is it clear? So when you have it, you can easily diagnose and then you can treat it. And this scabies is caused by a microorganism called the Sarcoptes scabies. Sarcoptes scabies. Is it clear? Sarcoptes scabies. Now, for the measles, it's going to be caused by the measles virus, while varicella is going to be caused by varicella virus, which is also called a herpes zoster virus. It's also called a herpes, human herpes type 3. Is it clear? Human herpes type 3 is divided into two, which is varicella virus and herpes zoster. Herpes zoster is what is going to result to herpes in cases of patients that have a secondary varicella infection. Is it clear? In old age, and they are mostly immunocompromised, like having HIV. Is it clear? So that is for the umbilicus and the skin. The next one now is when the point of focus is at the level of the urinary tract. Is it clear? So when the point of focus at the level of the urinary tract, you need to know that it's much more is going to be cases of females than males, because you can have the urethra of the females is usually very short. Is it clear? So when you have the urinary tract infection, it can be a lower or upper urinary tract infection where you palpate at the level of the suprapubic area, and you're going to have suprapubic tenderness, which can tell you that there is cystitis, and then you press at the level of the cosophrenic angle of the child to visualize if there is a cosophrenic angle tenderness. Is it clear? Costorenal angle tenderness. So those are the different elements that you have to visualize for lower and upper urinary tract infection. Now, when you have lower urinary tract infection, the microorganism that is associated with that is particularly the Enterobacteriaceae. Is it clear? And the Enterobacteriaceae are coming from the poor hygiene. If you are the feces, when the child has feces inside the pad, and then you are not removing directly the feces, can go via ascending route up to the urinary tract. So Enterobacteriaceae, particularly Escherichia coli. Is it clear? You have Klebsiella pneumoniae, and you have also Proteus. Is it clear? All that can result to urinary tract infection. We have other ones now. We have Staphylococcus aureus, which can come from the skin of the child, can also result to infection at the level of the urinary tract. Is it clear? Now, other microorganisms that can result to infection at the level of the urinary tract, you have schistosomiasis. They are parasitic infections at the level of the urinary tract. You have schistosomiasis. Is it clear? That you have to think. Is it clear? Like schistosoma, particularly schistosoma hematobium, that you have to think in cases of in urinary tract infection that is bloody. Is it clear? And painless. Is it clear? So those are the different elements that you have to think. So generally, viruses are not associated here. And for the GI tract also, when you want to think about that point of focus, you have to don't forget also about worms. And then you need to do also always need to do a worm infestation protocol to remove deworm a patient. Is it clear? Every 6 months to prevent that the child is having worms. Is it clear? But worms can be directly seen on the feces. When you see directly feces, it means that the child has worms. So those are the different elements that you have in the causes of the early onset and the late onset neonatal sepsis. So when you have that in mind, you can now go to the next point, which is the mechanism and the clinical presentation of neonatal sepsis.